back to Twin Cities Live. Listen, if you are suffering from osteoarthritis, you know it can be painful and hard to move. So this month, we want to talk about a treatment option that you could start up in the new year so that maybe you don't have to live with that type of pain going into 2026.
No, not at all. So join us today as we thrive with Twin Cities Live to talk about a new treatment called low-dose radiation therapy. Is Dr. Ryan Funk, and he's with Minnesota Oncology. Good to see you, Doc. Thanks for being here.
Thanks for having me.
Yeah, so we are kind of like health nerds. Like, we love all these like advancements in medical technology. So we can't wait to hear about it. But I personally don't know a lot about osteoarthritis. So what exactly is it?
Sure, yeah. So osteoarthritis is going to be the most common form of arthritis in the world, in the country, and it is essentially just the breakdown of joints. It happens as we age. It happens if we're carrying a little bit more weight or if we've had old injuries. And those cartilage surfaces that are supposed to lubricate the joints, make them move smoothly, they just start to break down as we get a little bit older, and that's what.
So we're talking mostly like hips, knees. Is that like the most common?
Hands.
Wow.
It happens in the neck, in the back. Pretty much any joint that you might have, you can get osteoarthritis in that joint.
So you're finding people are in pain, they lose their mobility, and I mean, those are huge things, especially as you get older. If you lose your mobility, it can be so hard to enjoy your life, to kind of soak up the experiences that you want to experience. So let's talk about this low-dose radiation. When I hear radiation, I think scary, okay? So what is this, and how is this a good thing?
Yes, and that's, so this is a treatment that's been used in Europe for decades.
Wow.
And actually, radiation was discovered in 1895, and in 1898 is the first report of using this for arthritis.
No way.
What? It's been used for over 125 years.
Okay.
So when we talk about radiation, what we're talking about for joints is very low dose. So I'm a cancer doctor for most of what I do, and so when a patient comes in, we're treating for cancer, we're using very, very high doses, trying to kill cancer. For osteoarthritis, we're trying to set back some of the inflammation that happens in those joints. And so we're using about 5% of the dose that we typically use for a cancer.
And then what's happening? Is it like a machine, or what are you doing?
So first, with the machine, we are using a machine that circles around the body, and we can treat from different angles. Okay. And it'll target just the joint that we want to target. So it's a very focused dose. In terms of inside the body, what we're looking at is the inflammation, the parts of your body that help fight infections. Sometimes they start to attack joints or other things. And at very low doses, radiation can help reduce that inflammation and actually slow down some of the progression of that destruction of the joint.
Well, so he's so good. He answers questions when we ask him at the same time.
I know.
Wow, unbelievable.
I was jumping on you thinking you were going to ask the same question, and we asked two different questions, and he's so good, he answered them both. So it's not necessarily repairing anything. It's really more about flushing out and pushing out that inflammation.
Yep. And so what we're often looking at with radiation is these are going to be patients where the joint damage has gotten to the point where things like Tylenol, ibuprofen aren't working as well. Yeah. But before we're getting so far that they need a joint replacement or something like that. Okay,
so you say it's a series of 6 treatments that can generally make a big difference for people, and then they're going to have some pain relief. And then is this like one and done, or do they come back?
So you can repeat this. So typically what we'll do is we'll do that first set of 6 treatments, and we'll usually do that over 2 or 3 weeks. And then we'll reassess at about 2 to 3 months. And if the pain's gotten better, we'll just watch and see how things go. If the pain has not gotten better, we'll actually repeat that dose again at about the 3-month mark. And roughly 70–80% of patients will have significant improvement in their pain.
I mean, that's amazing, because, daily ibuprofen, daily Tylenol, not great. Not great to take all the time.
No, not at all. I mean, it's going to be like harmful for your stomach and your kidneys and all that other stuff. So if you're going to do these treatments, then are you free? You just walk in, get the treatment done, and you're free to go back to regular activity, or do you have to like take a break?
No restrictions. Now, the pain relief is usually going to happen over the course of 2 to 6 weeks, and so it's not immediate pain relief like taking a Tylenol. Within 30 minutes you might feel better. For most patients, it's it's going to take a few weeks for this to work.
So this is offered at the Maplewood Clinic for Minnesota Oncology, and I think what a cool idea. If you've been struggling with this or you've had this diagnosis, go check it out. See if you might be a candidate, because it could really be life-changing.
Yes.
Thanks for asking 2 questions at once. We asked them, you answered, and
good.
really very good.
Real good.
Thank you. Okay, so if you want to learn more about this treatment and providers, Minnesota Oncology is the Twin Cities' largest and only independent care provider. They offer expert, compassionate care. They're close to home. I learn so much every time these doctors are in here.
I love it when they're here. Minnesota Oncology has more than 100 cancer care specialists and multiple locations across the metro. The Colon and Rectal Surgery Associates recently joined the practice, expanding comprehensive care options as well. You can learn more at mnoncology.com. Don't go away. We'll be right back.